Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Protein in urine causes and treatment. Proteinuria is the presence of too much protein in the urine. It is typically a sign of kidney disease, often in people diagnosed with diabetes, but also can occur with pregnancy, lupus, and other health conditions. One of the main signs of proteinuria is foamy urine, but that can occur in healthy people, too. /r/n/r/n proteinuria often has no symptoms, and some studies find that only about a third of cases are linked to kidney disease. In many cases, the underlying cause is never known, or the accurate diagnosis relies on other co-occurring symptoms. /r/n/r/nBlueshot, Getty Imagesrnrn Typically, there is very little protein in your urine. The kidneys provide a filtration barrier that prevents most proteins from leaving the blood, and those that do make it through are simply reabsorbed back into circulation. /r/n/r/n Different mechanisms can permit protein to escape into the urine, including even transient proteinuria due to dehydration, or due to postural proteinuria. The latter condition, sometimes called nutcracker syndrome, occurs when blood vessels are compressed and affects both adults and children. /r/n/r/n Foamy urine is not diagnostic of proteinuria. In fact, some people may have bilirubinuria, excess bilirubin in the urine, or retrograde ejaculation, the backflow of semen into the bladder. /r/n/r/n If the kidneys have sustained only mild damage, proteinuria may be minimal to moderate, depending upon where in the kidney the damage has occurred. /r/n/r/n While foamy or frothy urine can be a sign of proteinuria, other factors can cause urine to be foamy on occasion. The foaminess should be persistent over time before considering other causes, like decreased kidney function. /r/n/r/n If the loss of kidney function is severe, proteinuria may be a part of a more serious condition called nephrotic syndrome. This causes fluid buildup and dyslipidemia, unhealthy levels of cholesterol or fats. /r/n/r/n Symptoms of nephrotic syndrome include /r/n/r/n Kidney disease is usually the first condition a healthcare provider will explore when there is excess protein in the urine. But other conditions can cause proteinuria, some of which occur independently of kidney disease. /r/n/r/n Proteinuria is a common feature of kidney disease. It is typically caused by damage to the tiny clusters of blood vessels that act as filters in the kidneys, called glomeruli. When these filters are damaged, more protein can escape into the urine. /r/n/r/n There are many causes of this, and it is collectively referred to as glomerular disease. /r/n/r/n Proteinuria can also be caused by damage to tiny structures called proximal tubules that return protein to the bloodstream. When these units are damaged, protein is forced into the urine. The impaired function affects other organs too, especially the heart. /r/n/r/n Proteinuria is common with the two main types of kidney disease. /r/n/r/n Other conditions that affect the kidney can lead to proteinuria and include /r/n/r/n Overflow proteinuria occurs when the amount of low molecular weight proteins in the blood exceeds the amount the kidneys can filter. When this happens, the excess protein exits the body in urine. /r/n/r/n Certain conditions can cause overproduction of proteins that, in turn, leads to overflow proteinuria. /r/n/r/n There are certain medications that can cause proteinuria. These drugs are classified as nephrotoxic because they are toxic to the kidneys. /r/n/r/n Medications and substances commonly associated with nephrotoxicity include /r/n/r/n Proteinuria is not a disease but rather a condition caused by another illness. As such, the treatment is mainly focused on resolving or managing the underlying cause. /r/n/r/n. For instance, the symptoms of acute kidney injury, formerly known as acute kidney failure, will usually clear once the underlying condition is treated. In most cases, the kidney function will return to normal with no permanent damage to the kidneys. /r/n/r/n. With chronic kidney disease, CKD, the focus is placed on improving the function of the kidneys to slow the progression of the disease, often linked to diabetes and high blood pressure. With respect to proteinuria, /r/n/r/n. Diagnosing proteinuria can be diagnosed with a simple urine test. This involves dipping a specially treated paper strip into a sample of urine. Results are returned within 1 to 2 minutes. /r/n/r/n. To measure the exact amount of protein excreted in the urine, your healthcare provider may recommend a 24-hour urine collection test. By evaluating the composition of urine collected over 24 hours, including different types of proteins and waste products, the lab can calculate how much protein is passed each day. /r/n/r/n. Urine dipstick tests are commonly performed in a healthcare provider's office, but there are at-home and myelin tests that you can use in the privacy of your own home. However, the urine dipstick test may not be as accurate. Talk with your healthcare provider about the urine test. /r/n/r/n. Normal results of a urine test called the urine albumin-creatinine ratio, UACR, fall below 30 mg per gram. For levels between 30 and 299 mg, it's considered moderately high and increases your risk, or a diagnosis, in some cases, of kidney disease. At 300 mg or more, the likelihood of kidney disease is much higher. /r/n/r/n. While these tests can tell you whether or not you have proteinuria, they cannot tell you what caused it if you do. For this, you would need to see a healthcare provider. Other tests may include /r/n/r/n. Proteinuria doesn't always mean there's a serious problem, but seek immediate medical care if you experience the following. /r/n/r/n. These are common signs of kidney failure, a condition in which the kidney function has dropped so severely that you may require hospitalization to avoid illness or death. This is especially true if the symptoms develop over the span of several hours or days. Without treatment, kidney failure is associated with a high risk of death. /r/n/r/n. Proteinuria is the presence of protein in the urine. It commonly occurs in people with kidney disease when the filters of the kidneys, called the glomeruli, are damaged. /r/n/r/n. There are other causes as well, including drugs that are toxic to the kidneys and medical conditions that cause the excess production of protein in the body. The treatment of proteinuria varies by the underlying cause. If chronic kidney disease is involved, exercise, changes in diet, weight loss, and medications may help slow the progression of the disease and help alleviate proteinuria. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.